differences by countries. And we've spoken many times about the challenges of comparing mortality by country because there are so many factors that could be associated with these differences. And just calculating mortality, we're looking at deaths over time, reported deaths over time. And if you look at deaths by million population, or if you look at a crude case fatality ratio, there are challenges with all of these estimates, which could have to do with the surveillance strategies and testing strategies of finding cases, have to do with access to care, early care, access to oxygen, et cetera. And of course, we are learning, and frontline workers are learning how to care better for patients. But it also is affected by the populations that are affected. We've seen in some countries the majority of the deaths are due to cases that are identified in long-term living facilities. This has been a tragic aspect of this pandemic, and something that can be tackled, and something that we could focus on and make sure that we prevent the opportunity to enter into these vulnerable populations. And then just to add that some countries will be revising the deaths as they go forward and looking at attributing deaths to COVID directly, indirectly, and whatnot. And there are systems in place in Europe, for example, the Euromomo program, which is looking at excess mortality across Europe, and there's other systems in place in other parts. So it will take us some time to really understand mortality. But having said that, there are many things that we can do now to prevent infections. And by preventing infections, we are ultimately preventing the opportunity for someone to advance to severe disease and death. So this is a major focus of ours and all of the member states to do as much as we can, as quickly as we can, to reduce mortality where possible. DG?
Okay, thank you. I just wanted to add a few things. One, what we're saying is the number of cases is on the increase. It's actually accelerating very, very fast, and I have already provided the figures. But it's still positive. It's still possible by using the comprehensive approach to minimize transmission, and we have to focus on that. But what we're saying is we have to be even more focused, and we have to do more to save lives, to minimize mortality. And many countries are doing that, and that's why it's leveling off, and we have to invest on that. But one more thing I would like to say is on the Americas, I'd like to say that especially the Caribbean countries are doing very well, both in terms of suppressing transmission and also in terms of saving lives. But not only the Caribbean, the Pacific countries are also doing well. And there are some positive or good progress in some parts of the world too. But overall, we're really concerned, as I said earlier.
Thank you very much. That question stimulated a really rich discussion. We're running out